Question number 6, the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. Does he stand by his statement last week on Canterbury District Health Board that, quote, "I was down there in November announcing the extra 13 million, and that is more than ample to cover the 4 million that Canterbury said it was necessary to cover mental health demands," end quote.
The Honourable Dr Jonathan Coleman.
Yes, and I quote the Canterbury District Health Board CEO. He said in his written update to staff yesterday, quote, "You may recall we received additional funding late last year. This has enabled the DHB to sustain its level of investment in mental health services while at the same time delivering on a financial break-even position." Quote, close.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Was the chairman of the Canterbury District Health Board incorrect when he said at the Select Committee last week that Canterbury DHB had, quote, "a deficit in our budget of $17 million and the government gave us another $16 million to balance our books"? So actually it was already spoken for. It was actually so we would come in with a zero budget rather than a deficit budget.
The Honourable Dr Jonathan Coleman.
Well, I can't really see what the member's point is, quite frankly. Canterbury DHB said to us they had a $16 million deficit. We said, yep, we'll fund that up front, and then they will be able to use that money at their discretion to fund whatever services the CEO thinks is appropriate. And he said that some of that money should be used for mental health services, and that's what he's using it for.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Did Canterbury DHB receive $222 per head of population for mental health funding for 2015-16, while the national average was $243? If so, why did he say in Parliament last week that he absolutely disputed the DHB's claim?
The Honourable Dr Jonathan Coleman.
No, what they received was $147 million of ring-fenced funding. That's a $23 million increase on 7 years ago, and they'll receive more in this budget because the Canterbury DHB budget has gone up by $254 million over the last 7 years, and it's now at $1.36 billion. That's a huge budget, and the CEO gets to decide how he spends it.
Point of order, the Honourable.
Point of order, Mr Speaker. I'd like to table the Canterbury District Health Board CE's update newsletter, quoted by the Minister. It's dated the 15th of February, which they say they got 222.
Order. Member will resume her seat. I'll put the leave. There's no need to further describe it. Leave sought to table that particular newsletter. Is there any objection? There is none. It can be tabled. Supplementary question, the Honourable Annette King.
Has Canterbury DHB been told for the 2016-17 financial year that they can expect another decrease of $10 per head for mental health, even less than the 2015-16 funding, and is he still insisting they can live within their budget?
The Honourable Dr Jonathan.
No, they haven't been told that. The member's making it up. Basically, they're getting $147 million this year ring-fence for mental health. It'll go up next year.
Yeah. Point of order.
I take exception to the Minister saying I'm making it up. I've offered to table the information that he quoted where it says they get $10 less.
Order, no, order. Now, order. The member's answer wasn't helpful, but it's hardly disorderly to stand up and say that he disagrees with the figures and the member's making them up. Supplementary question, the Honourable Annette King.
What will it take for him to listen to the pleas from staff and the people of Canterbury to take their mental health issues seriously, particularly in light of the latest earthquake and the challenges that they face, like the 20-week wait list for child and family mental health services and a 55% increase in suicide-related call-outs since 2011?
The Honourable Dr Jonathan
Mr Speaker,
Coleman.
look, I'm in touch with the District Health Board all the time. I've been in touch with the Chair today. The fact is that we have put in an extra $86 million above the population-based funding formula to support Canterbury Health through the earthquake period. We've put in a $950 million hospital rebuild program, $13.5 million in budget 2014 over 4 years for the psychosocial recovery plan. There's a lot going in there. I will be down there regularly. The PM's down there regularly. Canterbury is an absolute top health priority for this government. Sorry, but it's true.
Question number 7.